has captured the attention of medical researchers and healthcare professionals alike. This syndrome, characterized by its distinctive symptoms and complex etiology, poses significant challenges in terms of diagnosis, treatment, and understanding. To fully comprehend the implications of Xenoflare syndrome, it is essential to delve into its origins, manifestations, and the current state of medical knowledge surrounding this condition. Xenoflare syndrome first emerged in the medical literature in the early 21st century, with initial reports documenting a cluster of patients presenting with unusual and severe inflammatory responses. These patients exhibited a range of symptoms, including chronic pain, extreme fatigue, and periodic flare-ups of intense inflammation that seemed to have no clear trigger. The term Xenoflare was coined to describe the foreign or alien-like nature of these flare-ups, which appeared inexplicably and wreaked havoc on the patient's bodies. The syndrome is believed to have a multifactorial etiology involving a combination of genetic predisposition, environmental factors, and potential autoimmune components. Researchers have identified certain genetic markers that appear to be more prevalent in individuals with Xenoflare syndrome, suggesting a hereditary aspect to the condition. However, the precise genetic mechanisms remain elusive, and ongoing studies aim to uncover the specific genes and pathways involved. One of the hallmark features of Xenoflare syndrome is its unpredictable nature. Patients can experience long periods of relative stability, followed by sudden and debilitating flare-ups. These episodes are marked by intense pain, swelling, and redness in various parts of the body, often accompanied by fever and malaise. The flare-ups can last from a few days to several weeks, significantly impacting the patient's quality of life and ability to function. Diagnosing Xenoflare syndrome is a challenging process due to its rarity and the lack of specific diagnostic tests. Physicians typically rely on a combination of clinical evaluation, patient history, and exclusion of other conditions to arrive at a diagnosis. Blood tests may reveal elevated inflammatory markers, but these findings are nonspecific and can be seen in various other inflammatory disorders. Imaging studies, such as MRI and CT scans, may be used to assess the extent of inflammation and rule out other potential causes of the symptoms. The treatment of Xenoflare syndrome is primarily focused on managing symptoms and reducing the frequency and severity of flare-ups. Nonsteroidal anti-inflammatory drugs, NSAIDs, are commonly prescribed to alleviate pain and inflammation. In more severe cases, corticosteroids may be used to provide rapid relief, although their long-term use is associated with significant side effects. Immunosuppressive medications, such as methotrexate and biologic agents, have shown promise in controlling the autoimmune component of the syndrome and preventing flare-ups. Lifestyle modifications and supportive therapies also play a crucial role in managing Xenoflare syndrome. Patients are encouraged to adopt a healthy diet, engage in regular physical activity, and practice stress reduction techniques such as yoga and meditation. Physical therapy can help maintain joint function and mobility, while occupational therapy may assist patients in adapting to the limitations imposed by the syndrome. Research into Xenoflare syndrome is ongoing, with scientists exploring various avenues to better understand its pathophysiology and develop more effective treatments. Advances in genomics and proteomics hold the potential to uncover novel biomarkers and therapeutic targets. Additionally, clinical trials are investigating the efficacy of new medications and treatment approaches, offering hope for improved outcomes for patients with this challenging condition. Support groups and advocacy organizations provide valuable resources for individuals affected by Xenoflare syndrome. These groups offer a platform for patients to share their experiences, access information, and find emotional support. By fostering a sense of community and raising awareness, these organizations contribute to the overall well-being of those living with the syndrome. In conclusion, Xenoflare syndrome is a complex and debilitating condition that presents significant challenges for patients and healthcare providers. While much remains to be learned about its underlying mechanisms and optimal management strategies, ongoing research and advancements in medical science offer hope for better understanding and treatment of this enigmatic syndrome. Through continued efforts in research, clinical care, and patient support, the medical community strives to improve the lives of those affected by Xenoflare syndrome.